She's just arrived in the ER. It's her first pregnancy. She collapsed in the market and had seizures. Her blood pressure is extremely high. Hi, I'm Dr. Sylvia, a general practitioner and health educator. Welcome to this episode talking about high-risk pregnancy. Guys, this is a long video, but believe me, it is well worth your time, so I hope you will stick around with me to the end. A high-risk pregnancy can be defined simply as a pregnancy with a high potential for challenges or complications that could affect mom or the baby. These pregnancies can develop problems in the first, second or third trimester, during labor, or even after delivery. Today we're going to look at some conditions or groups of conditions that could render your pregnancy as high risk. In addition, what could your medical team be doing in order to minimize the risk and lead to a safe delivery for you and your baby? Number 1, age. Being too young when a woman falls pregnant is a risk because her physical, emotional and mental immaturity can affect a successful pregnancy outcome for both the young mother and her baby. Older mothers from the age of 35 years upwards run risks of developing conditions like high blood pressure in pregnancy or preeclampsia, which could affect baby's growth and development and lead to delivery complications. Another point is that the risk of having babies with genetic or chromosomal disorders does increase as women grow older. One well-known example is with trisomy 21, which is the chromosome abnormality in people with Down's syndrome. Number 2, if you have pre-existing health conditions, there is a chance that you may become very ill when pregnant. In other words, being pregnant could increase the stress on your body. That condition can also affect your baby's development in the pregnancy, leading to premature birth or delivery by cesarean section rather than a vaginal birth. Some examples of these conditions include high blood pressure. Make sure you go and check out my video on high blood pressure in pregnancy and preeclampsia, where I explain how this condition develops, potential effects it can have on the mom and the baby. Other conditions like diabetes mellitus, asthma, sickle cell disease, thalassemia, cystic fibrosis, lupus disease, anemia, other health conditions that affect the heart, for example, ischemic heart disease or cardiomyopathies, and many other health conditions. Number 3, suppose you experience any complications in an earlier pregnancy. In that case, they may affect your ability to have a normal pregnancy in future, or those same problems may occur again in a future pregnancy. For example, having 2 previous cesarean section births means that the next time you're likely to have another cesarean section and not attempt a vaginal delivery. The next is having gestational diabetes. Another one, high blood pressure in pregnancy. Also, conditions that can affect the progress of labor, for example, abnormal position or lying position of the baby. Next, a recurrent miscarriage. This is also known as a cervical insufficiency, where your cervix starts to open in the absence of contraction from the womb, of course, leading to premature labor. And any other conditions that can increase the risk of preterm labor fall into this category. Number 4, assisted pregnancy. Any pregnancy conceived via IVF, IUI, or other measures outside of natural conception will require increased monitoring. Number 5, infections can affect the successful outcome of any pregnancy. In addition, some have the potential for very severe problems unless they are carefully managed. With effective antivirals that we have these days, women with HIV can have successful pregnancy outcomes while remaining well enough after birth to care for their child. Another example is COVID-19 infections. This can put an exposed or infected pregnant woman at higher risk of developing blood clots, especially life-threatening pulmonary embolism. Remember, the risk of having a blood clot is high when you're pregnant. COVID-19 further increases that risk in pregnant women. Therefore, they will need regular monitoring and anticoagulant treatment, that is treatment to thin the blood, while also battling the risk of developing pneumonia from the COVID-19 infection. Now, vaccines reduce the risk of adverse outcomes in pregnant women with COVID-19. Remember, pregnancy is a relatively immunocompromised condition. In other words, the woman's immune system is intentionally reduced in order to reduce the chance of mom rejecting her own baby. While this is good for the baby, it renders mom at a higher risk of contracting infections like COVID-19. Vaccines help to prevent this outcome. Number 6, first-time pregnancy. Yes, this could be a risk for some ladies. This is because the changes that a woman's body goes through when she's pregnant can create problems that first time, which are better managed on the next occasion that she's pregnant, because we know about these conditions already. Women who are pregnant for the first time can also be at a risk of certain conditions. For example, high blood pressure in pregnancy. Number 7, multiple pregnancy is a fantastic outcome that many couples would love to have, but it also brings several problems. Low birth weight, the risk of preterm labor, and high blood pressure developing, to name just a few issues that your medical team will need to be on top of if you have a twin or triplet or other multiple pregnancy. Number 8, we've been talking a lot about physical health problems, but please remember that mental disorders can also have a severe effect. Conditions like severe depression, bipolar disorder, severe anxiety are a few examples. As a result, the mom's ability to bond with her baby or to care for her baby after birth is severely disrupted. This can also lead to the baby developing emotional problems in future. 9, the presence of some gynecological problems could affect the pregnancy. Examples you could find in this group are fibroids that coexist with pregnancy. They could cause pain, they might lead to heavy vaginal bleeding, or lead to preterm labor. Another gynae condition that may cause complication is endometriosis. Number 10, where there are any abnormalities in the baby. This can include problems like heart defects, hydrocephalus, which can affect how the baby grows, may lead to preterm labor, and the possibility of surgical delivery instead of a vaginal birth. Number 11, blood group disorders. The most common of these is Rhesus disease or Rhesus incompatibility. In this condition, a baby's blood cells are destroyed after his blood mixes with his mother's through the placenta. But why or how does this happen? Well, first, we all belong to different blood groups and types. In this particular condition, we're looking at the Rhesus type, where you could be Rhesus positive or Rhesus negative. Now, if a woman who is Rhesus negative carries a child with a blood type Rhesus positive, the mom's blood mixes with her baby's blood through the placenta, and her blood becomes sensitized to Rhesus positive blood. This is the case in her pregnancy, whether she has a miscarriage, goes on to terminate that pregnancy, or she goes on to deliver her baby. That first baby is perfectly fine. Mom is doing well too, but her blood now contains Rhesus antibodies against Rh positive blood, which she picked up from mixing with her first child. Now, if she becomes pregnant again, this is where the danger happens. If baby number 2 is also Rhesus positive, remember mom is Rhesus negative. When mom and baby's blood mix, as happens through the placenta, the Rhesus antibodies from mom's blood pass into the baby's circulation and begin to destroy the baby's blood cells. This situation causes Rhesus disease, and initially what this baby will have is severe anemia that can progress to jaundice. Jaundice is yellowness of the skin of the different tissues in the body. It can be severe enough to cause life-threatening problems. If Rhesus disease is left untreated, severe cases can lead to stillbirth. And if that doesn't happen, devastating problems like brain damage, learning difficulty, hearing loss or eyesight loss can still develop. Our Rh type is inherited from our parents. So in this instance, the mother is Rh negative and the father Rh positive. Their children can inherit either type from both parents. And this is one of the reasons why we take a complete account of all your pregnancy history and arrange for you to have blood tests to know your blood group and type when you come for your antenatal booking class. So when we identify ladies with the Rhesus negative type, we can give them an anti-D immunoglobulin treatment that mops up any antibodies in their blood. The baby is safe. But if we don't do this, we might end up with a very sick child. Number 12, endocrine conditions like thyroid disease. Your thyroid gland is responsible for normal performance and function of literally all the cells and organs in our bodies. It is so important. If it fails to work properly in mom or baby, they can be at serious risk of ill health. 13, neurological conditions such as epilepsy. Keeping seizures under control with the right drugs and the right dose is vital for any woman with epilepsy who is pregnant. Care is also required to ensure she avoids or quickly manage any triggers for seizures. Both mom and baby can potentially be harmed if this condition is not well controlled. 14, abnormal weight, including being excessively overweight or excessively underweight. Both of these can affect a woman's ability to safely carry her pregnancy and her baby's development. Preterm birth complications, anemia, electrolyte imbalance, developing blood clots. These are just a few challenges that either of these conditions can cause in pregnancy. High-risk pregnancy issues can develop as pregnancy progresses and not just at the beginning of pregnancy. Some treatments that your medical team will undertake include, they will want to get a detailed account of your medical information, all about you, your family, your partner, every bit of information that helps to know what we need to do to minimize any risks in this pregnancy. Number 2, we will carry out blood tests, including tests for genotype, tests for blood group, tests for anemia, tests for diabetes, and so on. 3, you will have regular scans, and the frequency will depend on the condition that you have, but it is essential that the progress of your pregnancy and baby's development are carefully monitored throughout pregnancy. 4, drug treatments. Of course, this will go hand in hand with regular monitoring, but you can have different drugs for different conditions. For example, aspirin. This is used if a woman has preeclampsia to reduce the risk of developing problems like a low growth rate in the baby or the chance of preterm labor. Another drug that could be used depending on your condition is progesterone, which supports the growth of the pregnancy. Anti-hypertension medication will be important for blood pressure in pregnancy or preeclampsia. You could also be given steroids to help the maturity of your baby's organs and to support the pregnancy. So, more frequent scans, blood tests, appointments with specialists in addition to midwives and general practitioners. You have the whole team on hand to help to minimize any risk from this high-risk pregnancy. After birth, it continues. The focus is on any persisting problems that a woman can still have. For example, with her blood pressure, with her blood sugar, any infections that might develop, or even the possibility of blood clots. The team will pay attention to issues around the baby's birth, for example, if it's premature, any risk of infections, mom's mental health, breastfeeding issues, and any other areas that mom and baby require support. Earlier, I discussed the risk of mental disorders during pregnancy, and this risk can continue after birth. So, please give this video a like, but go and check out this one on postnatal depression next.